The United States Agency for International Development, also known as USAID, yesterday marked 10 years of strengthening Namibia's pharmaceutical supply chain. The event also highlighted accomplishments made and lessons learned over the past years. With more details on some of these achievements, I'm now joined by Rosalia Indongo, TB HIV Adviser to USAID in Namibia, as well as Mr. Lazarus Indongo, Deputy Director of Pharmaceutical Services at the Ministry of Health and Social Services. Good morning and welcome to GMN. Maybe we'll start with Ms. Rosalia. Just give us a little bit of a background. There's a big word, supply chain management. We're talking pharmaceuticals. What are we really talking about here this morning?
We are talking about a very key component of in the HIV response. As you may know, the response had grown from just giving education and promoting health to giving treatment. And now that treatment is available, supply chain is a key component of that in the response. And the program that we are talking about played that pivotal role.
Okay. How did, Mr. Ndong, obviously from the Ministry's perspective, how did the provision of the supply chain management system change the kind of service delivery when it came to delivering pharmaceuticals?
Supply chain management came in Namibia in 2007. Now we say that yesterday there were 10 years in Namibia. And what they found, they didn't find on the scratch anyhow, they found 36,000 patients on treatment. But within those 10 years, now we are talking about 150,000 on treatment of HIV/AIDS. So you see this is very tremendous achievements. Approximately, we are talking about 1,500 average each and every year people are put on treatment of antiretrovirus tablets. Yes.
Wow. Well, given that type of, increase in the numbers of the people on the system, maybe you can contextualize some of the achievements. Obviously, that's an inherent achievement, but maybe there are others that came with the introduction of the system that enhanced service delivery within the healthcare sector. Ms. Ndongo, talk to us about the achievements.
Yeah, there are many that includes the capacity building of the people that render pharmaceutical services. We had to train, we had to build the infrastructure for pharmaceutical delivery, transportation. When the project started, at that time, as a short-term measure, we had to recruit pharmacists and people that are working in that industry to ensure that the services could continue. But then we also had to support the ministry to think medium and long term. And as a result, in the 10 years that we are talking about, the Namibian School of Pharmacy, the establishment thereof was also supported through this system. And then there was another program at the National Health Training Center that also produced pharmacy assistants, and a program that started with an output of 10 students of pharmacist assistant is now producing an average of 40 per year. Wow. So these are the kind of inputs. Now, you know that, as Lazarus has said, that we started off with 36 or 39,000 patients being on treatment, and now we are talking about over 150,000 people being on treatment. That alone needed medicine that are more than what it was before. And as a result, even the space in the warehouses needed to be considered. And the time, planning and focusing as to where to get the medicine, how to get it here
Internal.
and to deliver it timely to the respective places where it's needed. So these are the kind of support that went into supporting the ministry. And I must say what we have heard yesterday speaks volumes that people are happy, the support was valued, it delivered what it intended to deliver, and I think if you are in development, that's what you want to be associated with. So as USAID and USG in particular, we are very proud to be associated with these achievements.
Obviously, even those achievements, we can say, oh, somebody got 80% and passed the test very well. But we know that 20% where they didn't do that well, it could be as a result of some challenges. So, Mr. Lazarus, also, given these achievements, we obviously know that there could have been some challenges. What could those be, or what are those challenges currently?
Yeah, the challenges in particular is we know that all the government have problem in staffing. And there are also challenging of people who are turnover. You train people today and then they go to other places or they change to green pasture. And those are the most challenges. And challenges which also we have with some of the patients, they are also trying to not to comply for taking medicines, but now with EDT, we call it electronic data collections, so that we can follow people where are they, so that they can come and get their medicines. Okay. There's a lot of challenges, but with the supply chain management system, we overcome most of those challenges.
Okay. Just in conclusion, Ms. Indongo, tell us why it is important for USAID TB to support government in this initiative.
It is important to support the government in this initiative because Namibia, just like the rest of the world, is striving at bringing this epidemic under control. The second thing is also that Namibia is interested in contributing to end the HIV epidemic. So alone, it cannot do it. It needs stakeholders, and we are one of those stakeholders to just support where we can. This project in particular was one of the key components of an effective response to support an AIDS-free generation, and for Namibia in particular to also bring the HIV epidemic under control. Because as they say, this is a medicine-driven epidemic. You need medicine, and without the medicine, there can't be an effective program. So the SCMS program and the 19 million that we spent over the past 10 years was so crucial to ensure that all the aspects that government deemed necessary were supported, and it could make the difference that has been reported. Okay. So I believe that everybody listening or watching this program and those that knows the program have seen the tremendous progress that Namibia has made in the HIV response. And we are actually also praised as a nation that has made so much progress over a short period of time. And it is because the country has partners such as PEPFAR that supports it.
Okay. I think, Mr. Indongo, I see you want to say something in conclusion?
Yeah. In addition also what my colleague said, I just wanted to say this, when we see that in 2007, when the SCMS the government has spent 36%, But nowadays, as we are talking, they are supporting 75. That means that they are increasing the budget, and we are, as a country, we are taking that as our custodian.
Ownership. Thank you very much for coming in and sharing, I think, such a successful program with the nation.
Thank you.
Well, Namibia, that is Rosalia Indongo, TB HIV Advisor at USAID Namibia, as well as Mr. Lazarus Indongo, Deputy Director of Pharmaceutical Services at the Ministry of Health and Social Services. I think the big message is Namibia has done well in responding to the HIV epidemic by introducing a system that is able to adequately respond to the people who need the pharmaceuticals in order to be treated to ensure that their lives are extended. I think that's good work from the partnership that was formed between USAID and the ministry. We're talking Orango Red.